Hello, 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 good people, and welcome to Happy, Healthy, Whole with Sharea. This is our Wednesday wisdom for our Practice Well path, which is dedicated to the mental health professional looking to start, which is launching, maintain, and grow your practice. I hope that that looks different for each of us, but I hope that I'm able to help support you. I know last week we talked about understanding your why and your niche, and so this week we are going to uncover more about how do we sustain after we know our why and our our niche. And so really this is about not trying to burn out while you're serving others, as well as creating a actual business plan and or business model that is sustainable. But a business doesn't work for a business that doesn't work for you won't work for your clients either. Let's start by talking about pricing, multiple streams of income, and the system that can keep you sane. What does that mean? If we think about pricing, let's think about how much a therapist needs to make and how they need to be freed from feeling guilt and fear and imposter syndrome when it comes to not undercharging for your actual business and your practice. But when we think about pricing, we have to think about it from the perspective of allowing ourselves to serve more people long term. So really when we think about our actual price and profitability, we have to think about what will be long term and sustainable. Things like what do you need to earn to sustain a lifestyle and business expenses? This means that it's not just looking at, I need to make $100,000. It's looking at what it looks like to have the life to travel, have the life to be able to have less than 20 to 25 clients in my practice each week, what it looks like to do or to do that balancing act so that I can maintain my expertise while still not burning out, while also still paying my bills and paying myself so that I'm also achieving more than just a salary that I would have gotten from if I just worked for someone else. And so being able to ask that first question really honestly to yourself around lifestyle and business expense is going to help you with your pricing. What value are you bringing to your client is the next question that I want you to ask yourself. We talked about last week understanding your why. If you're able to really clearly know your why, but then communicate your niche to your niched audience, then your value can be about being clear and specific to who you're working with, at the same time making sure that they're allotted the methods to be able to connect with you in terms of finances. And so if I say that I'm working with high achieving Black women, most likely that means that they're able to not just achieve, but maintain a certain salary that will allow for them to maintain therapy as part of how they practice their own routine of care. And so that's just one example. And are you factoring in things like taxes, administrative time, and continuing education? Not only is those important business, but they're ongoing business expenses that will be a part of your growth and maintaining your actual expertise as you develop. And so your rate isn't just about the time you spend in the session, it includes everything it takes to run the actual practice. The next thing we need to think about when we are really thinking about business beyond the couch and creating this sustainable practice is what is our expansion plan beyond the one-on-one session? The reality is that one-on-one sessions can start as a great foundation. You don't want to rely on them solely because what will lead to is more likelihood of burnout as well as the amount of work that you have to do administrative. It's just going to cost you more mentally to be able to maintain your practice that method only. So what things are you going to incorporate? Think about group therapy or support groups, workshops or trainings for organizations, digital products like ebooks or courses, consultation for businesses or agencies. What am I going to scale my practice to? Tip number two within this same one is as you're thinking about diversity of service, think about diversifying in a way that is going to fit your schedule during these turbulence times. You are human and your emotions are going to be connected to the same level of wanting to activate into advocacy, wanting to support communities. Think about, how do I sustain myself as the support to most supporting things to most people in my work specifically? How do I do that without trying to create and or be everything to everyone? And so one of my tips is that I just gave you 4 different examples: group therapy, workshops and trainings, digital products, and consulting. What I would suggest, instead of trying to do them all, is to pick one and to focus in on creating that strong next foundational service outside of your one-on-one, so that you can literally start diversifying and grow as you're doing that same, as you're launching, starting, or growing your practice. Think about that from the perspective: if we diversify our income, not only does it protect you financially in turbulent times, but it also allows you to serve in a different way. And so I will say that my first method was trainings, because I was already doing trainings before I was actually doing foundational work with outpatient or individual one-on-one. And so when I focused on the one-on-one and making that our primary service as a foundation, I was able to then pull back or bring back our trainings as the next thing. And then ultimately the next following was our our consulting for businesses and agencies. So think about it from the perspective of stepping up. Trying to do it all may burn you out, even if it's bringing on additional means of income. All right, that's enough, because I could go on and on about that. And then lastly, building systems for sustainability. What I always notice when I'm coaching people or talking to people about their practice is that they don't have any systems. They're just doing things and have no real means of keeping things in order. And so think about it from the perspective of working with your clients. We would tell our clients, one thing at a time, break it down into steps, make sure that you are able to celebrate along your steps. So I'm thinking, when we come to systems, we want to be very clear on what our EHR system is, which is our electronic health record system. We want to have our automated scheduling and billing, which means that we can either do it ourselves or we have someone who's doing it for us on our behalf, whichever method is yours. But also things like automated scheduling for your clients. Are they able to come to your calendar? If not, are you able to have an intake worker that will be able to go to your calendar and set them up immediately, so that you're always filled and it's also working, and it also isn't working or creating more work for you that should be either a person and or a system. And a scheduler can be just as helpful, right? But you also got to make sure that you keep them synced in correctly, because I also watch a lot of people have these scheduling systems, but they don't have all of their calendars synced to it. And therefore, they sometimes will have clients scheduled that they didn't even know were there, and or they cancel appointment last minute because they overbooked. Anyway, that's just a get off my horse for a second. And then the last thing is, think about templates for all of your forms in terms of documentation. So things like intakes, progress notes. Think about templates that allow for you to keep the process as easy as possible. Again, a lot of systems now can also be just broken down through AI. And so consider even putting in one of the AI, many of the AI bots will allow you to do some form of outline on what systems you need to actually run your specific practice. And you can actually put in the actual unique parts of your business to make sure that it's giving you the different systems that you may need. So this is just a small way to start looking at how you can set up to not only just start to develop your practice, but to actually start to think about how it looks to expand. Setting up systems now will help you to free yourself and create more time to then build on those different levels of multiple streams of income. Your clients will thank you, and your well-being will thank you when you are organized with systems and ready to scale your practice. Your challenge this week is to review your pricing and explore the new revenue streams that align with your expertise. For next week, we're going to talk about the mindset shift that's needed to thrive as you build your practice. All right, y'all take good care of yourselves. Be well.